We are pleased to present our study on visual morbidity in patients with ophthalmic segment aneurysms treated with flow diverters, a dual-center experience. Flow diverter treatment for aneurysms of the ophthalmic segment of the internal carotid artery may raise concerns about visual morbidity related to coverage of the ophthalmic artery by the device. Our objective was to evaluate clinical and angiographic outcomes associated with flow diverter treatment of these aneurysms, with particular emphasis on visual morbidity. We report the experience at 2 high-volume cerebrovascular centers with the flow diverter treatment of these aneurysms. Here is a representative example of a 6 mm ophthalmic segment aneurysm with a daughter sac on biplane angiography of the left internal carotid artery, with the ophthalmic artery origin having no involvement with the aneurysm, as well as deployment of a flow diverting stent under fluoroscopy. Ophthalmic segment aneurysms are among the most common intracranial internal carotid artery aneurysms and are a frequent target for endovascular therapy owing to their incidence and location. As is commonly done, the flow diverter covers the ostium of the ophthalmic artery. Although multiple studies have shown that branching arteries remain patent even after being covered by flow diverters, patency of the ophthalmic artery remains of particular concern to many operators. Decreased flow through this branch may result in loss of visual acuity or transient blindness, and its occlusion or occlusion of the central retinal artery branches can potentially result in permanent visual field deficits or monocular blindness. Therefore, we performed a retrospective analysis of the endovascular databases at 2 U.S. centers to identify consecutive patients with aneurysms along the ophthalmic segment of the internal carotid artery that were treated with flow diverters between January 2010 and December 2022. 113 patients with 113 aneurysms were identified for inclusion in the study. The mean age of the patients was 59 years old, and 103, 91%, were women. The ophthalmic artery origin was involved in 35% of aneurysms, consisting of a neck origin in 29% and a dome origin in 6%. New transient visual morbidity during the hospital stay included impaired visual acuity or blurriness in 1 patient, diplopia in 1, and floaters in 1. All were 0.9%. New transient visual morbidity during follow-up included impaired visual acuity or blurriness in 5 patients, diplopia in 3, ipsilateral visual field deficits in 1, and floaters in 6. Permanent visual morbidity occurred in 1 patient, 0.9%. Among the 101 patients who had angiographic follow-up, the Raymond-Roy occlusion classifications were 1 in 84%, 2 in 11%, and 3 in 5%. In our experience, flow diversion for ICA ophthalmic segment aneurysms resulted in low rates of visual morbidity, which is mostly transient in occurrence. Thank you.